What if the pill you take every day is slowly damaging your heart? After 60, your body changes, but your medications don't. And that silent mismatch could be putting your life at risk right now. You're standing in your bathroom, same routine you've done 1,000 times. You reach for that orange bottle, shake out a pill, swallow it with water. Done. 30 seconds tops. You don't read the label anymore. Haven't in years. It's just part of getting through the day, like brushing your teeth, like putting on your shoes. That bottle in your cabinet right now, the one you refilled last week, the one your doctor prescribed so long ago you can't even remember the conversation. You trust it completely. Every single day, that pill is doing something inside your body that wasn't happening 10 years ago. Something your doctor might not even realize. Something the pharmacist never mentioned when you picked it up. Your heart has beaten over 2 billion times since you were born. 2 billion. And right now, some of those pills you're taking every day are making each beat harder, riskier, more dangerous. I'm Dr. Richard Ben, and in the next few minutes, I'm going to show you 5 medications that millions of people over 60 take every single day thinking they're safe. And I'm going to show you exactly what they're doing to your heart that nobody talks about. Your body after 60 is not the body that started taking those medications. Let me show you what changed. Your liver is running at 70% capacity compared to your younger years. That's the organ that breaks down medications, 70%, which means every pill you take stays in your bloodstream longer at higher concentrations, doing more than it ever did before. Your kidneys have lost 20 to 30% of their filtering power. They can't flush medications out the way they used to. So those drugs accumulate, they build up, they stack, your blood vessels have stiffened. They used to expand and contract like elastic bands. Now they're more like old rubber, cracked and rigid. Your heart muscle has thickened from working so hard all these years. It needs more oxygen, more rest, more care. Now drop a medication into that system. A medication that was prescribed when you were 55 when everything still worked at full capacity. The equation has completely changed. Same dose, completely different effect. And most doctors never recalculate. Right now, while you're watching this, I want you to think about what's in your medicine cabinet, because one of these 5 categories is probably sitting there and you need to know what it's really doing. The first medication is one you take without even thinking about it. Ibuprofen, naproxen, Advil, Aly, and if you have a prescription to Clonak, you probably have one of these within 10 feet of where you're sitting right now. Maybe in your pocket, your purse, your nightstand. You've taken them so many times, you don't even consider them real medications anymore. Watch what happens when you take just one. Within 30 minutes, every blood vessel in your body constricts. Not much, just a little, but enough. Your kidneys immediately start holding on to salt and water. Your blood volume increases. Now you have more liquid being forced through narrower pipes. What has to happen? And your blood pressure goes up 5 points, maybe 10. One pill, one time, not a big deal. But you don't take it one time. You take it when you wake up with that knee pain again after lunch, when your back starts hurting. Again before bed because your shoulder is aching 3 times every day. For months, for years, that blood pressure increase becomes permanent. Those blood vessels stay constricted. Your heart is working overtime, every single hour pushing harder against more resistance. And then one day a blood clot forms or a vessel ruptures or your heart muscle just gives out from the strain. The doctors call it a heart attack. They write it down in your chart, but they rarely connect it to that bottle of ibuprofen you've been taking daily for the past 3 years. Studies show regular NSAID use increases heart attack risk by 20 to 50% in people over 60. That's not a small number. That's 1 in 3 people who could have avoided it. You're taking it for pain. I understand. But there's something you need to know. That pain isn't worth your life. And there are safer ways to manage it that we'll get to in a few minutes. If you're taking any anti-inflammatory pain medication more than twice a week, keep watching. What comes next is even more important. The second medication, the one quietly stealing your mind, alprazolam, lorazepam, diazepam, clonazepam. The names all end in Pam or Lam. You take it at night for sleep, for anxiety, for that racing mind that won't shut off. Your doctor gave it to you during a stressful time. That stressful time ended, but you never stopped taking the pill. Why would you? It works. You sleep, you feel calmer, but something else is happening. Something you've been blaming on age. You wake up at 2 in the morning to use the bathroom. You swing your legs out of bed, stand up, and the room tilts just for a second. You grab the wall, steady yourself, make it to the bathroom, and back. You've stopped thinking about it, It happens every night. Or you're talking to your daughter on the phone. She asks you a question. You open your mouth to answer, and the word is just gone. Vanished. You laugh it off. Senior moment, you say. But it's not age. It's the medication. These drugs slow your brain. They slow your reflexes. They slow your muscles. In a 20-year-old, that makes them sleepy. In a 70-year-old, it makes them fall. And this is where it gets dangerous. When someone over 65 falls and breaks a hip, the chance of dying within 1 year is 20 to 30%. Not from the fall itself, from what comes after. The surgery, the anesthesia, the stress on your heart during the operation, the blood clots from lying still, the pneumonia from not moving, the delirium from the pain medications, the cardiac arrest in the hospital bed at 3 in the morning. All from a pill you took to sleep better. People taking these medications have double the fall risk. Double. And long-term use, we're talking more than 3 months, is now linked to dementia. Your brain literally shrinks. Memory centers deteriorate. The sleep you're getting isn't even quality sleep, it's sedation. You're unconscious, not resting. Your brain can't do the repair work it needs to do. You wake up groggy, confused, slower, and here's what almost nobody tells you. The longer you take these pills, the harder they are to stop. Your brain becomes dependent. Stopping suddenly can cause seizures. It has to be done slowly, carefully, over weeks or months. But it can be done, and we'll talk about how. If you recognize yourself in this, don't panic, but don't ignore it either. The next medication is even more directly dangerous to your heart's electrical system. The third medication, the one disrupting your heart's rhythm, amitriptyline. That's the name you need to remember. Doctors prescribe it for nerve pain, diabetic neuropathy, migraines, even insomnia. Sometimes it's an old medication, been around for decades. Doctors trust it, but your heart doesn't. Your heart runs on electricity. Every beat is an electrical impulse that travels through specific pathways at specific speeds. Perfect timing. Like a symphony, amitriptyline disrupts that timing. It slows down one critical phase called the QT interval, the recharge phase between beats. When that gets too long, your heart can fall into chaos. Ventricular tachycardia, ventricular fibrillation, those are the rhythms that kill people suddenly without warning. You might feel it as palpitations fluttering in your chest, racing heartbeat out of nowhere, or you might feel nothing at all until you collapse. This medication also drops your blood pressure when you stand up, orthostatic hypotension. Your brain isn't getting enough blood, the room spins, you go down. Again, we're back to falls, fractures, surgery, cardiac stress, death. There are newer medications for nerve pain, gabapentin, pregabalin. They work just as well without touching your heart's electrical system. Most doctors know this, but if you're already stable on amitriptyline, they might not want to rock the boat. But the boat is sinking. You need to know that. If you're on this medication and you've ever felt your heart skip, race, or pound for no reason, that's your body screaming at you. Listen to it. The fourth medication is one you probably don't even think of as a medication because you bought it at the drugstore without a prescription. The fourth medication, the one you buy without thinking, diphenhydramine, Benadryl, the pink pills, it's in your allergy medicine, your cold medicine, your sleep aids. Anything with PM on the label probably has this in it. Over-the-counter means safe, right? Wrong. This medication blocks acetylcholine in your brain. That's the chemical responsible for memory, attention, learning. When you block it, your brain goes into a fog. But here's what the label doesn't tell you. In older adults, long-term use is directly linked to dementia. A study followed thousands of people for over a decade. Those who took medications like this regularly had a 54% higher risk of developing dementia. 54% from an over-the-counter sleep aid. And it doesn't just affect your brain, it affects your heart. It can cause tachycardia, rapid heartbeat, arrhythmias, especially if you're taking other medications that affect heart rhythm. The confusion it causes leads to falls. The dry mouth leads to not drinking enough water, which leads to dehydration, which stresses your kidneys and your heart. You're taking it to sleep. But there are antihistamines that work just as well without crossing into your brain. Loratadine, cetirizine, same allergy relief, no brain fog, no dementia risk. For sleep, we need to fix why you're not sleeping, not just knock you unconscious. One more medication to go. This one is specifically for blood pressure, and it might be the most immediately dangerous of all 5. The fifth medication, the one that drops you too fast, nifedipine, the immediate release kind, soft gel capsules. Some doctors give these as rescue medications for when your blood pressure spikes. You check your pressure at home, it's high, you panic, pop one of these. Blood pressure drops. Crisis averted, right? No. This medication hits your system like a hammer. Your blood vessels dilate fast. Too fast. Your blood pressure doesn't gradually come down over hours. It plummets in minutes. Your body can't adapt. Your brain suddenly isn't getting enough blood. You feel lightheaded, dizzy. You stand up and pass out. Or worse, your heart panics. It starts racing to try to compensate for the sudden pressure drop. That racing combined with reduced blood flow can trigger a heart attack. The medication you took to prevent a stroke just caused a heart attack. Modern blood pressure medications work slowly over 24 hours, smooth and steady. That's what your aging body needs, not a roller coaster. If you have these capsules in your cabinet for emergencies, you're carrying a loaded gun, and it's pointed at yourself. Now you know 5 medication categories. Millions of people over 60 take at least one of them every single day. This isn't about the medications being evil, it's about context. These drugs were prescribed when your body was different, when your liver worked faster, when your kidneys filtered better, when your heart was stronger. That's not true anymore. The medication needs to change or it will change you permanently. The heart attacks aren't always dramatic. Sometimes it's just that your heart gradually weakens. Heart failure, you get more tired, more short of breath, fluid builds up in your lungs, your feet swell, your doctor treats the heart failure, more medications, diuretics, ACE inhibitors, beta blockers, but nobody stops to ask why your heart started failing in the first place. It might be that ibuprofen you've been taking for 5 years or the damage is sudden, a clot, a rhythm problem, cardiac arrest, and everyone says, well, they were 70, these things happen. But do they have to? You're not helpless. This isn't a death sentence. It's a wake-up call. Tomorrow morning, before you take anything, go to your medicine cabinet. Take out every single bottle, prescriptions, over-the-counter vitamins, everything. Line them up on your kitchen counter. Look at each one. Read the name. Ask yourself, do I remember why I started taking this? Is that problem still happening? Have I noticed any of the symptoms I just heard about? Write it down. Make a list. Medication name. Why you think you're taking it. How long you've been on it. Any symptoms that might be connected. Now call your doctor's office. Tell them you want a medication review, not a regular appointment, a full medication review. Bring your list. Bring all your bottles. When you sit down with your doctor, you're going to have a different kind of conversation than you've ever had before. Don't say, I watched a YouTube video and I want to stop all my medications. That will get you nowhere. Say this instead, I've been on some of these medications for years. My body has changed. I want to make sure everything I'm taking is still appropriate and safe for me now. Can we go through each one and talk about whether there are better options? Your doctor wants to help you, but they're busy. They see 30 patients a day. They don't have time to proactively review everyone's medication list unless you ask. So ask for each medication. Have specific questions ready. I'm taking ibuprofen almost daily for arthritis. What are safer long-term options for pain management? I've been on this sleep medication for 2 years. What's the safest way to come off it, and what can I do instead? This nerve pain medication was started 5 years ago. Are there newer alternatives with fewer cardiac risks? Your doctor might not change everything immediately. Some medications can't be stopped quickly, but you've started the conversation, and that conversation will save your life. Now let me give you alternatives that actually work for pain. Physical therapy does more than pills ever could. Strengthening the muscles around a painful joint removes the stress on that joint. Heat therapy, cold therapy, topical anti-inflammatories that work locally without going through your bloodstream. Acupuncture, TENS units, movement, walking, swimming, yoga designed for seniors. These aren't soft options, they're effective options, and they don't come with cardiac risk. For sleep, fix your sleep environment. Blackout curtains, cool room, no TV, no phone for 1 hour before bed, same bedtime every night. Your body will relearn how to sleep naturally. If you're not sleeping because of anxiety, treat the anxiety. Therapy, meditation, breathing exercises. Exercise during the day so your body is actually tired at night. If you snore or wake up gasping, get tested for sleep apnea. That's killing your sleep and stressing your heart every single night. For anxiety, cognitive behavioral therapy works as well as medication. Better, actually, because the results last after you stop. No side effects, no fall risk, no dementia risk. You can do this. Your body wants to heal. You just have to stop poisoning it with medications it can't handle anymore. I need you to hear this clearly. You are not trapped. You are not doomed to take these medications forever. You have options. You have control, but you have to act, not tomorrow, not next week, today. Because every day you wait is another day these medications are working against your heart. Another day of increased risk. Another day closer to that event you can't come back from. Starting right now, pay attention. How do you feel 1 hour after taking each medication? 2 hours. Do you feel foggy, dizzy, off balance? Does your heart race? Do you feel weak? Your body is talking to you. It's been talking for months, maybe years. You've been ignoring it, blaming it on age. Stop, listen. Your body knows. Over the next week, track one specific thing. How many times you feel unsteady on your feet? Write it down. Every time. You might be shocked at the number, then track your memory. Every time you walk into a room and forget why, write it down. Every time you lose your keys, your phone, your train of thought, bring that information to your doctor. Real data, not just feelings, numbers. And remember, never stop a medication on your own. Some of these, especially the sleep and anxiety medications, can cause seizures if you stop suddenly. It has to be done under medical supervision, slowly, carefully. But it can be done. People do it every day. They get off these medications, they feel better, think clearer, move steadier, their hearts get stronger. You can be one of them. Watch for these warning signs over the next few days. Any dizziness when you stand up, any confusion that comes and goes,